Hello, I'm Dr. Donald Backstrom here at Backstrom Chiropractic and Wellness. I've been in practice about 22 years, and we're here to do a little educational information about what is applied kinesiology or muscle response testing. It's one of the diagnostic things that we use at the office very frequently, and at least initially it can be a little confusing to our patients because they don't quite understand what we're doing. So let's describe it. First off, the human body is very electric. We all know that because we've had experience. When you wipe your feet on the carpet, you go up and you touch somebody, there's a static discharge, and sometimes that discharge can actually be somewhat painful. Also, if I'm making a connection here, I'm actually making an electrical connection between the two of us. How would I know that? Well, if I get shocked or if I stick my finger in the outlet, that electrical charge is going to go through my body, right through your body, and anyone else that is touching you. So, since we now understand that the human body is very electric, why would it be so electric? Well, we have roughly 24,000 miles of nerves in the human body. It's a phenomenal miracle. That's enough to go around the earth at the equator. The nerves are very small, and they're in the skin, they're in the muscles, they're in the bone. You have a whole little nervous system around your heart, and you're just literally awash in electrical activity. On the skin, it's called galvanic skin response, and you can actually measure the activity, and it'll change based on how the person is feeling. It'll also change on what their stressors are and other things like that. So now that we know that the human body is very electric, what we can do is we can show you how that works. Because if I'm making a connection here, and I'm making a connection here, now we're making a loop, and we can use a strong muscle. So if we have a muscle here, I'm going to push down, you push up. Good. So all we're interested in is a strong, intact, non-painful muscle and joint. And then if I just touch here, I'm making a loop, and this electrical activity that's going through both of our bodies is also going through the joint here, and it's still strong, which is great. That's what we're looking for, is to see if this activity is moving. Now, since the human body is very electric, the analogy I like to use is that it's like the fuse in the fuse box in your house. If we want to check the main switch, again, do we have a strong muscle? We do. This is called the testability point, or the on-off switch. As you can see, when I touch here, this is weak, and you're pushing as hard as you can? Absolutely. And if I'm not touching, that's strong. If I touch somewhere else, this is strong. So what's occurring, this is called the testability, or the master switching center. The brain has a polarity front and back to it, and there's an acupuncture point right here that lets us know if the brain activity is functioning appropriately. In this situation it is. Now that we know that, we can gather information about the organs, we can gather information about the spine, we can gather information about the peripheral joints, we can gather all kinds of information about how those areas are electrically functioning. So if we just check a couple of organs, let's say, how's the liver? So I just hold and touch right over the acupuncture point around the liver, and I see that it's weak, so that means that this loop that we're making has some area of resistance because something is not functioning ideally in the liver. How about the heart? Heart is working great in her situation, so we can literally go through and check all kinds of organs. The other thing that we can do is we can use this to check the joints. So again, remember, I'm making a loop here. How's the shoulder joint itself? It's actually pretty good. Now, how's the elbow joint? So something's not occurring, and she's actually getting a little crunching or crackling when we do that. And we can go through the spine, and we can go, how's the thoracic spine in these areas? How's the cervical spine? How's the lower cervical spine? So you can see she has some things that are occurring in different areas of the spine. So the wonderful thing about this muscle response testing is that we can gather information about how the joints are functioning, how the muscles are functioning, how the organs are functioning, how the spine is functioning. And it's information that you don't even have to have symptoms in the area, but we can use this as a way of finding where you would potentially have a problem, so that we can, without you having symptoms, we can check function, because what we're ultimately interested in is optimal function in the human body, and this is a wonderful way of being able to diagnose it and use your own body as a feedback tool for all kinds of information. Thank you.